allegedly the exact same copy to the doctor is just ridiculously dangerous. And I think that if you had an AFI, if you had, and never mind if it's Toronto Public Health or any public health, I think you should call your doctor's office and confirm, is it the same letter?
Here in Toronto, Ontario, I'm Tamara Ugolini for Rebel News, and my guest today is Annabelle Edge, who is grappling with the fallout of a vaccine injury following 2 Pfizer doses received in the summer of 2021. Adding insult to her injury, not only does Annabelle have pre-existing medical conditions, but Toronto Public Health, which is Canada's largest health unit, are acting as the gatekeepers to the federally implemented vaccine injury support program called VISP.
Vaccines are safe and effective. Serious side effects are incredibly rare. In the very unlikely event of an adverse reaction, though, we want to make sure that Canadians have fair access to support.
And they actually created barriers for her to have her injury formally diagnosed and recognized by issuing 2 separate letters, one to her and, unbeknownst to her until 2 years later and exhausting advocacy efforts, they sent a separate, differently worded letter to her family doctor.
The first vaccine, June 1st, I had, it took a couple weeks for me to recover from that. It was a flare. I had to take some gabapentin, is the drug that they give you for that. But in 2-3 weeks, I was all right. The whole month of July 2021, I did not have to take anything for it. I was back to my regular self. So I thought, okay, I've heard people having a few rough days after the vaccination. I guess this is just my version of it. So I went again on August 1st to get the second vaccination. And at first it was okay, it seemed okay, but then probably about 3-4 days later, I started noticing that I had a pain in my neck that wasn't really typical of the sort of transient pain that I would get. And it just started getting worse and worse and worse. Because of my difficulty with the first vaccine, I had arranged to go camping with my kids, because when we're camping, Mama just has to lay in the hammock. They do all the cooking and cleaning by themselves. If they get into a fight, I tell them to just walk the other direction. So it's a really easy way for me to recover. But this time I was not recovering. I was getting worse and worse and worse. Even taking the gabapentin wasn't working. And so the first time I went to the hospital was on August 8th.
What you're getting at, or what I'm hearing, is that it was really within days. And over the course of a week or two, you were really noticing that this was having a very strong impact and lingering and lasting more than it had the first time, which you chalked up to being kind of a normal immune response. Yeah. And that's really also a narrative at the time, was that the vaccine's working. If you're having reactions, that means that it's working. And now we're 2.5 years later, and you have gone through the checks and balances. We know there's a multi-level filtering bureaucracy involved in trying to get a vaccine adverse event or an adverse event following immunization, called an AEFI, reported and documented to the appropriate authorities.
Well, I actually went to the hospital 3 times in total. After the 3rd time at the hospital, I was realizing, oh wow, this needs to be reported. I mean, I genuinely thought this was part of my civic duty. Like, this is, you're having an AEFI, you're supposed to report it. And so my doctor did fill out an AEFI report. She put, it was Bell's palsy and also lymphedema, a lymphatic response from the swelling. And I just assumed that something would come to investigate this, or some sort of attention would be paid to help me out. Like, I'm a single mom of 2 kids. So we reported it to Toronto Public Health, and they responded with a letter shortly after. So I thought the letter that I was emailed, I thought I was kind of confused that they'd taken out Bell's palsy from the letter, that it just used the word neuralgia flare. So, and I was confused as to why it didn't mention shingles at all.
And given these pre-existing conditions, the fact that you had COVID, the natural infection, and were recovered, you would think that that might hint at a contraindication to receiving a novel rush to market mRNA pharmaceutical product.
Yeah, and I actually, the second time I went vaccinated, I did actually sort of, was a little, I mean, I still trusted. I still thought I was in good hands. I did actually mention it to the people at the convention center. We went at the bottom of the CN Tower to go get it. I sort of asked about the safety of it, and first person didn't want to talk to me at all. Second person, and I just got really, really negative energy. And I asked for it to be noted on my vaccination record.
When was it that you noticed that, in fact, there were 2 different letters issued by Toronto Public Health?
It wasn't until June of 2023, last year. And because I had this letter from Toronto Public Health saying that I should be referred to an ENT. That's the letter I had. I kept asking my doctor, can I see an ENT? Can I see this? I didn't know that there were 2 separate Toronto Public Health letters dated November 4th, November 4th, 2021, until the day I showed up to that ENT appointment that I'd finally gotten. And the nurse, there was something going on with her printer didn't work. She was very rushed. So she just through the slot asked me to double check, are these your records to be sent? And I was like, oh yeah, there's Toronto Public Health. And then, wait a minute. And then I opened up my own files and compared the 2 letters. And that was the first time I realized that the public, when I was, all those times when I've been in my doctor's offices and all the people who had subbed in for her, a carousel of doctors, when I had said, look at the Toronto Public Health letter, it says refer me to an ENT. The Toronto Public Health letter they had in their system didn't say that at all. They inserted a paragraph into the one that was sent to my doctors. There's a good part of it, sort of. It says, while there are safety signals for COVID-19 vaccinations and neuralgia, it's possible the immunogenicity stimulated by vaccination may have exacerbated your pain. So that actually does describe a biological mechanism, right? But then it goes on to say another explanation for her symptoms may be functional neurological disorder, best understood as a disruption to the brain's normal mechanisms for controlling the body, often triggered by a combination of abnormal physical and psychological experiences. We would expect FND to develop in some individuals after vaccination due to a combination of heightened stress owing to the pandemic, feelings of uncertainty about the vaccine, and the normal transient physical symptoms for after vaccination. So it's basically saying that vaccine hesitant people may start focusing on things and develop a somatic condition because they're convinced the vaccine did something to them.
And this isn't the case with your condition. You have proof that it is a physical ailment, and so. And
that's one of the things for FND and the DSMV when the diagnostic thing is if there's another likely cause that explains the symptoms, you shouldn't be applying this.
Right.
So I gave them the benefit of the doubt, wanted to let them know that, hey, how did this happen? And then it turns out that they had been doing it on purpose. They apologized profusely. They understood that this was not an appropriate thing to be doing. The logic of why you would do this just doesn't make sense.
Thankfully, you have kept immaculate records throughout all of this, and you did record that conversation. So we'll play a small insert of that recording.
What the letter that we have on files, we have two.
Oh.
So what I see here, that had done, and I do apologize for the confusion because I would understand as a client, I wouldn't understand it either. So there's one that she had sent over to your family physician, Dr.
Mm-hmm.
And then there's one that she had sent to you. The one that she had sent to Dr. has an additional paragraph and a bit of a sentence. Let me just.
It actually has 2 additional paragraphs.
So I have here while there's no safety signals for
Yep.
COVID-19. You have both, correct?
Well, I just found out on June 21st that the letter my doctor received is not the same as the copy that was sent to me by Toronto Public Health.
Then what nurses were doing is they were sending out additional information based on the consult that the physicians had sent on our end. So they wrote another explanation for her symptoms. They didn't want to provide the client that just because that might provide confusion. The intention behind the letter was the physician would go run it over with you, kind of explain what the letter means. I do understand the frustration because you were told that it's the same letter.
Yeah.
I know, and I'm so sorry just for the miscommunication on our end, and she's no longer with the organization.
Yeah.
But I could see the frustration. It was just more so the way that I believe that we would see it is the recommendation doesn't change. However, it's the blurb explaining that you're missing in your letter. It does. It's not as clear as it should have been. How would you like us to go about this?
When the panel said, listen, give it to 6-month-old babies with zero assurances this possibly would be safe. I said, where were you the day when the WHO came out and said, do not use remdesivir in the hospital? I'm Dr. Peter McCullough. Join me for an evening together. Tickets are on sale now.
And the intent here with Toronto Public Health to essentially create a barrier for you to apply to the federal and at the time newly implemented VISP, the Vaccine Injury Support Program initiative, which was supposed to alleviate the financial hardship of those who were experiencing reactions by compensating them so that they could seek appropriate medical care or be compensated for the time off of work, et cetera, et cetera. How did this create a barrier for you to get into that system?
It made a huge barrier. And that's the number one reason why I'm doing this interview is because I'm not the only person that this was being done to. I'm not, I know that for Toronto Public Health. I don't know if other public health agencies were doing this, but this idea of sending one letter to the patient and allegedly the exact same copy to the doctor is just ridiculously dangerous. And I think that if you had an AFI, and never mind if it's Toronto Public Health or any public health, I think you should call your doctor's office and confirm, is it the same letter? Mm-hmm. Because they were doing it intentionally, and I wasn't the only one. And it made a huge barrier, and it's not the fault of the doctors that were seeing me, because they're going off of what was given in front of them. And it's not my fault, because I was going off of what I was given in front of me. But it certainly dragged out the proper diagnosis of my condition by 2 to 3 years. The lines of, oh, it would be better if you heard it from your doctor than just in a letter, so the doctor was supposed to explain it. But how is that supposed to happen? Because there's nothing in the doctor's version that says we have not passed on this, option of the idea of this diagnosis to your patient.
Just this past summer, you had your medical review assessment done with the VISP, their hand-picked medical review board.
Yeah.
What has that process been like, and how has this all affected you over the last almost 3 years?
It's really emotionally dragging. I should be focusing on getting better, getting healthier. The things that I can do. Ironically, when nerves demyelate like that and swell and all the rest, there's a recovery window. And they say after the first year, that's what you've got. So not being able to get proper medical care has actually burdened me for life now with nerve damage, that I now have to learn how to, do things differently to compensate for.
How would a VISP approval help you moving forward?
I think a VISP approval would pay for the medical. I tried to get private health insurance, and they won't take me, obviously. So it would pay for all the medical treatments that I need that are not included in the basic, and those are medical treatments that I desperately need. I had asked my doctor, and she had said I would. I think this was a conversation with respect to my child, though. And she said I would not advise anyone not to get the vaccine.
After 2 years of rigmarole and tireless advocacy, Toronto Public Health finally issued EDGE a third letter in August of 2023 stating that they, quote, completed our investigation of the report and concluded that Annabelle Edge had E.6, other severe/unusual events, a flare in pre-existing neuralgia, and B.3, adenopathy/lymphadenopathy. Edge asserts that this was never submitted to VISP, and her application based on the original letters has since been denied, leaving her without compensation for her injuries and back to square one. I did reach out to Toronto Public Health for comment, and despite previously stating that they don't respond to Rebel News, somebody already responded that they are looking into this query and will be in touch. Stay tuned for an updated report if warranted. We've launched a special website at nommoreshots.ca where you can send a form email to the Federal Minister of Health, Mark Holland, calling on him to revoke market authorization for these injections. At that website, you can also stay up to date with all the reports and sign up so you never miss the next one. That's nommoreshots.ca.